Hey y'all, hey, welcome. I am Dr. Cherry Estelhomme, and I am here as we go over chapter one of our textbook, Crisis Assessment, Intervention, and Prevention, Jackson, Cherry, and Erford, the third edition. All right, let's get into it. Chapter one deals with the basic concepts of crisis and intervention. And so, as we go through chapter one, the first thing we wanted to do is we want to really define what is a crisis. So, for starters, we have to understand that a crisis is an event that may or may not cause a disruption in life, right? And a crisis doesn't necessarily lead to trauma. And so, we want to kind of put it into perspective and understand what it is and how we experience it for different people. So when we look at trauma, when we look at crisis, especially, we want to look at the trilogy of events that happen that we kind of put into perspective to define what actually is a crisis. What is the event that may or may not have caused a disruption in life? So the first thing we want to look at as it's a precipitating event, right? That's the first part in the trilogy. Something happened. Okay. The second part is that something that happened, the perception of it, did it cause subjective distress? So keep that in mind. Not only is it an event, but it's the perception of the event, right? And so let's say that there was a car accident. For one person, the perception of that event, of that car accident, may mean that their entire life is disrupted because the car accident could have ruined their car, which would have ruined them having transportation to work, would have caused them to lose their job and caused them to, not being able to take care of their family. It's a whole snowball effect. Whereas for somebody else, a car accident could simply mean, hey, now I'm about to get paid and I'm about to get a brand new car. And their life is not disrupted at all. Maybe they have great car insurance. They're going to go get a rental car and life is going to go on. So, what is the perception of the event and did it cause subjective distress? And then the third part of that is how you function in the midst of that distress. So everyone has their own way of coping with things. But did this precipitating event cause so much subjective distress that now you have diminished functioning due to your normal ways of coping? So if your normal ways of coping are simply taking a deep breath, simply praying about it, having the resources to get through it, if those things aren't working and all three of these things are combined, that's how you would actually define the crisis, the precipitating event, the perception that causes subjective distress, and then your functioning. I can no longer function the way I normally would, no matter what my coping skills are telling me to do, because this is an actual crisis. And so James and Gillian, 2017, they actually combined a definition of the term crisis, and I want to read it verbatim. It's a perception or experiencing of an event or situation as an intolerable difficulty that exceeds the person's current resources and coping mechanism, right? And so all that has to be put together. Do my current set of resources allow me to make it through this event? If my house burns down, do I have insurance where I can go stay at a hotel, or do I have, finances where I can afford to stay at a hotel, or did I lose everything, or am I in a renter situation and I don't have renter's insurance? And so you have to look at the resources, you have to look at the coping skills and all that combined and look at how it affects the person. Remember, not every single event will affect every person the exact same way, right? Some things just don't bother some people where others, may cause severe trauma. So when did we start looking at crisis intervention theory? Crisis intervention theory began to be studied in earnest in the 1940s, and it's still being studied today. But back in the 1940s, a lot of things were taking place. One of the main things that was taking place was World War II. And so these families experienced this disorganization because families were leaving to go be a part of the war. And so the whole family dynamic was changed. Finances were different. Women no longer were housewives. They had to go out and work and help provide for their families. And everything was disorganized and it caused all these snowball effects of crisis. And so that's when it began to, started being studied in earnest back in the 1940s. And that was one of the main things that triggered the study of crisis intervention theory. And so I went ahead to, sorry about that. Another thing that happened besides World War II, a very powerful precipitating event, was the Coconut Grove nightclub fire. And that fire happened in Boston, Massachusetts, where over 500 people died in that fire. And so a lot of studies came around, how is the community dealing with this? How are loved ones? How are, people coming together? What is their past experience with crisis? What is their current? What is their resources? How are they dealing with this massive loss, right? And so this actually sparked another set of studies and interventions that really sparked the crisis intervention theory movement. So one of the things that happened as a result of this fire was Gerald Kaplan and Eric Lindemann. They began to look at how do you help communities in crisis, and so they're actually considered some of the pioneers of the crisis intervention theories and crisis intervention movement. So Lindemann was a professor of psychiatry at Harvard Medical School, and he came up with a way to study psychological and emotional reactions after crisis. So he did all this study around people who were dealing with acute grief. And so he pretty much kind of spearheaded this notion that people in these traumatic events may need long term care. He also looked at some common clinical features like somatic distress, feelings of guilt, disorganization. He looked at these things as these people are dealing with this traumatic loss, and how are they, building their lives after the fact. So as a result of this, Lindemann and his colleague Kaplan, they created this project known as the Wellesley Project, which was a community-wide program in Massachusetts. It was there to help a lot of clients deal with the acute grief from looking at, from having this preoccupation with these images from this horrific and traumatic fire that took so many lives. So through this, Kaplan, Lindemann's colleague, created the concept known as preventative psychiatry. And so, what preventative psychiatry does is it looks at if people are have experienced traumatic events and they get a chance to have early intervention, then they can deal with these events a lot better. The theory was that preventative intervention would promote positive growth and well-being. Following this, Lindemann then created what we know as basic crisis theory. And his goal here was to make basic crisis theory an independent and a specific part, sorry, y'all, an independent and a specific part of crisis trauma or of crisis intervention. Okay. And since Kaplan, others have built upon his basic crisis theory. And this is kind of where we are today, how the field of crisis and trauma has kind of spearheaded into today. And we're going to look at some of the theories and some of the models that are relative, and all of them are that are relative to what we deal with today. So before we move on too far ahead, I want you to know the difference between crisis intervention and brief therapy. Brief therapy deals with ongoing mental health problems, and the aim in brief therapy is to decrease the symptoms. Whereas crisis intervention is very specific. Crisis intervention doesn't have to deal with ongoing mental health problems, but they specifically target the event that we talked about a few minutes ago, the precipitating event, the crisis event, the trauma. Crisis intervention deals specifically with the trauma. In 2000, Beverly Raphael, she built upon Kaplan's theory and she created psychological first aid. Raphael, she started working on this in 1977 in Australia after a horrific train accident. And with her psychological first aid, she really advocated for comfort and consolation of the bereaved families, reunification with loved ones, those that survived the train accident. And she really offered support for those who really wanted to express their feelings right there on the spot. And so, with psychological first aid, her goal was to give immediate care to those that were experiencing or lost loved ones to these horrific traumatic events. So for her, she made a point that in order to meet the needs, we first have to attend to the first aid like we would in an actual physical sense. But for this, it's psychological first aid. So we first have to meet the initial needs, like the comfort and the consolation, and just being there and providing initial emotional support. One of the biggest things that Raphael advocated for is her goal with psychological first aid was to prevent post traumatic stress disorder or PTSD. Again, her goal was to try to prevent PTSD. And so she was looking at this as if people are so traumatized that they can't deal with basic problem solving skills, then they have to, deal with psychological first aid. And so I kind of want you to keep this in mind as you're thinking about certain things that you may have experienced in your own life. And think about when you're in shock. Somebody who's in shock. Let's go back to a house being on fire. If the house is on fire, most people, can't think straight. Their goal is to just get out the house safe, right? Like they're not thinking, you know, of, which window, like the goal is just to get out the house. And then once they're out, they could be standing outside in their underwear in the freezing cold. Um, and they're just in shock that their entire house has burnt down. Like, it usually takes a neighbor or somebody to come and wrap them in a blanket. And that's when they'll realize, oh, I am cold. I am shivering. Right. And so you can't even do basic problem solving skills. And that's where psychological first aid comes in. And so even if we go back to Kaplan, we have to remember that the goal is the outcome of the crisis event, not the event itself, but the outcome of the event. So let's real quickly look at the four crisis domains, and how we actually apply crisis theory. So the four crisis domains are developmental crisis, situational crisis, existential crisis, and ecosystemic crisis. And so let's look at these four different crises. So developmental crisis has a lot to do with expected normal development. A pregnancy, someone trying to have a baby and they get pregnant, that's an expected normal development. Situational is something that is unexpected and catastrophic, like a terrorist attack, a rape, a sexual assault, a job loss, a sudden illness, anything that's just really unexpected and catastrophic, a car accident, a house fire. Existential crisis has more to do with sense of meaning and purpose. And sometimes it can have a lot to do with your religion, but it's not necessarily, but a lot has more to do with your meaning of purpose. Oh, I have a typo there. Hold on, let me fix that. Give me 1 second. Sorry about that. Again, an existential crisis has more to do with, your sense of meaning and purpose. It has to do with your shame, your guilt, your core beliefs. And then you have ecosystemic crisis, which is, it could be natural or it can be man-made, a situation, and it can affect systems or communities. And so the book outlines a very, very good example, because before you categorize somebody into one of these four domains, you have to understand how they perceive the crisis, right? Because crisis has a lot to do with personal perception. And so the book has a really good example about a woman who shows up in a clinic, and she's pregnant. And so originally you could assume that this is a developmental crisis. She's pregnant and she's a female. But then you can find out that the pregnancy was due to a rape. And so then it becomes a situational crisis, because it's, a sexual assault, something traumatic happened to her. But then you learn that she's thinking about aborting the baby, and she is feeling a lot of shame and guilt and feeling like God will be disappointed in her. And so then it can be looked at as an existential crisis. And so you want to understand how the person perceives the crisis. And yeah, there can be times when, you can have things in more than one category. It could be situational and existential. Um, or even that same woman, it's not mentioned in the book, but let's say that same woman is African American, and she feels like everyone in there is of a different race, and maybe she feels like they're looking down on her. Um, because of the color of her skin, and she feel like it's a ecosystemic crisis. And so you want to make sure you understand how the client perceives the crisis. Okay, so now that we understand what crisis is, how do we as therapists intervene or offer therapy to those that are in crisis? Let's look at some of the crisis intervention models. So, for starters, I want to make it clear that the textbook is not exhaustive on crisis intervention models. You're going to have to do a lot of research. There's a lot of intervention models out there, and some of the models are very specific to a client's crisis. So, make sure you do your research. But for now, we're going to look at the traditional models of crisis intervention, the modern models based upon ecosystemic theory, and then the modern models based on field practice. So the traditional models are things like the task model of crisis assessment intervention, the crisis intervention 6-step model, the cognitive model, the psychosocial transition model, and the equilibrium model. The modern models based upon ecosystemic theory are the developmental ecological model, the contextual ecological model, and then the modern models based upon field practice are the ABCX and the double ABCX model, the psychological first aid, the ACT model, and the eclectic model of crisis intervention. So in order to find an intervention plan that meets your client's needs, again, you have to first understand how they perceive the crisis. So let's start with the task model of crisis assessment and intervention. This actual model was actually created by the authors of the textbook, Jackson Cherry, and it actually has two different components. And let's take a look at them in detail. So one of the cool things about the task model is it starts with 4 essential assessment tasks that help you create the plan for the intervention plan. So you're going to go through these 4 steps of the essential crisis assessment, and then you're going to move into the 4 essential crisis intervention tasks, right? So we're going to kind of walk through these and look at how they work. All right, so let's start by understanding that in order to really help a client get to a actual plan, you have to really be able to define the problem. We talked about which of the domains to put it in. So you really want to understand the problem and their perception of the problem. And so the task model of crisis assessment and intervention, what makes this one unique is this one can be used across all spectrums of crisis. All right. One of the main things that you're going to do in the assessment task is you're going to address for safety. And so, as a therapist, you should always be mindful that you are safe and that your client is safe, right? And so, you want to make sure that whether they're self referred or they came in by mandated, that they are in a mentally safe place and a physically safe place. And you as well want to be in a safe place. You need to know if they are homicidal or suicidal, and that's how you get to the stabilization and risk. So you want to realize part of this assessment, the very first step in this assessment is understanding essentially what you're working with, so you don't walk into this blind. Because if a client isn't stable, you're not going to be able to get them through the other assessment tasks. So you want to make sure you completely deal with the safety and stabilization and risk factor before you try to move on to the second part of the assessment task. The second step in the assessment task is you want to follow a holistic biopsychosocial spiritual approach. So you want to understand exactly what you're working with. You want to look at, things about the client's past. Are they a substance user? When was the last time they had a medical exam? Have they been to the emergency room for any issues? Do they have any medical issues that you need to be aware of? And so you want to kind of just go through the whole intake process and find out what you're literally working with, right? So once you got them stable, you need to understand their background and their foundations, know what you're working with. Usually, to do this, you go through the ABCDE process, and it's affects, behaviors, cognitions, development, and environment. And so sometimes it's just the ABCs, but usually it's the ABCDE. So you want to go through all the steps and make sure you follow them to the letter and see what you're working with. The third task is clarify the problem. Oftentimes, a client will come in with one thing, and they're really dealing with something else. And so it might not usually, oftentimes, it's not the surface thing that has brought them to counseling. It's usually something deeper. So you want to take time to clarify the problem. You have to be mindful that a client may be dealing with multiple traumas at a time. And so you really need to, get to the root of what it is. And keep in mind what we've been talking about throughout this whole time is the perception. What is the client's perception of the problem? And so let's say, a client comes in and they're dealing with grief because their parent died. But you also find out that in that same month, they're they had a stillborn baby, a couple of years back, but in that same month. And then you later find out in that same month, a few years ago, they lost their job. And so now this month has significant meaning. That's not just a parent dying or just, their child being stillborn, them losing a job. But now this month is looked at as a traumatic event that could help them spiral. So you actually want to clarify the problem and understand, because you also want to be mindful that clients aren't engaging in negative self-talk, about this month, and what this month is a month of doom and trauma. And so you want to be really specific about clarifying the problem and understanding what the client is really dealing with. And then the last part of the assessment task, the fourth step, is exploring the coping skills, the resources, and support. How did the client deal with crisis in the past? And what are their normal coping skills? Also, what kind of resources do they have? What you talked about, a house burning down, do they have finances, to relocate? Or, if a loved one has passed, do they have a good support system that they can talk to? Um, you know, what kind of resources can you provide them? Can you provide them with grief counseling? So you want to look at what is already in place for starters, as part of the assessment task. What kind of coping skills are in place? What kind of resources are in place? What kind of support system is already in place? And so before you move into an actual plan, you want to look at what's in place. They might be very religious, and they may be a strong member of their church body. And so that may be a good support system and a sense of resource that they can lean on. And so you want to look at what's there and what's in place as part of your assessment task. So keep in mind, as we get ready to move to the intervention part, that the task model of crisis assessment and intervention, again, it's two parts. It has four parts that are the assessment, and then four parts that are the intervention. So even as you're doing the research, you need to address every step in each of these, which shouldn't take long. These steps can sometimes overlap and combine, but you make sure you want to address them and hit on how you address these points. So the next step in the task model is the four essential crisis intervention tasks. This is where you formulate the plan, right? And so the first thing you do in the intervention task is you want to normalize and educate. And so you want to help the client normalize their response to the crisis. People react in a lot of different ways, and oftentimes they'll look back and say, maybe I shouldn't have said or done that. But you kind of want to take that stigma away from them, and let them know, people normally don't think straight in crisis, and you did the best that you could. And so you want to normalize and educate, on how crisis affects different people and how resources and coping skills affect different people. And so you want to normalize and educate so you could take the stigma off of them, so they're not adding to the crisis by also walking in shame. Part two of the intervention task is to explore options. You want to look at the options that you obtain during the assessment portion, and you want to look at what resources the client has and also what resources the therapist can come up with. And you want to combine these, and you want to look at how can you give a client options for what to do, right? So you don't want to become a dictator. You don't want to tell them, no, you need to go back to the scene of the fire and stare at the fire and know that thank God you're alive. Like you don't want to just kind of dictate their life, but you kind of want to explore options. You know, is it possible that you talk with your pastor? Is it possible that you communicate with your church members? Or is it possible that you write a letter to your father, or, whatever things that you found out in the assessment task, how can those things be used as a benefit for the client and help the client through the crisis? Okay. So the key part for one of the key parts for the intervention tasks is IT3, which is develop a plan and obtain a commitment. So for the task assessment and intervention model, when you develop a plan, it's specifically specialized to the client. You're going to get the information from their assessment, and you're going to look at how you guys have done all the steps in their assessment, and you're going to help create a plan with the client. It's a co-collaborative effort that you're going to create a plan with the client and obtain a commitment. And you want to make sure that the plan is a SMART plan, that it's obtainable, it's specific. And so you do this as the third step in the intervention task. And then finally, the fourth task for the intervention is to prepare documentation, follow up, and provide referrals. And so once you've created this plan with the client, you want to make sure you document very well. You want to make sure that you are making sure that the client is connected with outside resources, they have referrals, and that you are following up to make sure that they're following their plan, that they're committed to it, and that you're still there helping them, that they have all the tools that they need to succeed. Okay. So again, the intervention tasks are to normalize and educate, explore options, develop a plan and obtain a commitment, and then prepare documentation, follow up, and provide referrals. All right. Those are those are the four essential crisis intervention tasks of the task assessment of the task model of crisis assessment and intervention. All right. So we're going to do a couple of more, and then we're going to move on. All right. Here we go. So one of the key models I want you all to be familiar with is psychological first aid. Psychological first aid actually is an 8-step model, but the goal here is to help clients who've had recent trauma. Specifically, it's really, really good for clients who've dealt with sexual trauma. And so there's 8 steps, and throughout those 8 steps, your goal is to look at all the resources that the client needs, listen to what the client is saying to you, and then link the client with resources. So the 8 steps for psychological first aid, or PFA, is one, contact and engagement. You want to be in contact with the client, engage with them, make them feel safe and comfortable. That's the safety and comfort step. You want to stabilize them because usually you've probably encountered them at a hospital, or they may have come to you and admitted or confessed that they've experienced a traumatic event such as a rape or some kind of sexual violence. Before, you want to gather information about them. How can you support them, or find out some of the things that happen so you can have the tools you need to help them. 5, you want to give them practical assistance, meaning you don't want to just kind of keep passing them on, because usually coming to you and telling the story was traumatic enough. 6, you want to connect them with resources that's going to help them, and so not just pass them on to other clients, but you want to make sure they have connection with resources like housing and trauma assistance and hospitalization. 7, you want to make sure they have a lot of information. Make sure that they have the necessary information they're going to need to aid them in this process. And then 8 may sound a lot like 6. 8 is the linkage step. It may sound a lot like connection, but the linkage is actually you actually helping them follow up to make sure that they're not just given a phone number, but they're actually connected to a person, who works in a crisis center. And so psychological first aid is a powerful, intervention model. Again, it's really good for uh, sexual assaults, but it can be used for almost any kind of crisis. A lot of these models are universal. They may have been designed for something specific like that, but they're pretty universal. We talked about psychological first aid a few minutes ago, when how it was first created, and it was first created because you know uh, you want to give them immediate comfort and care. You want to do a lot of consoling immediately. It's just like doing regular first aid, for patients, but you want to be there with them and make sure that at the scene, or even at the moment that they've been connected to you, that they are giving the really nurturing comfort and care. Okay. Another traditional model of crisis intervention is the crisis intervention six-step model. This model was designed for women that were in crisis, almost like the PFA, the psychological first aid. But the crisis intervention six-step model was designed for women. But keep in mind, again, like I just said, all of these models can have a universal feel. If you are, working with a client, and you are more comfortable with this model, you can make it work as long as you're following the steps. And so with crisis intervention six-step model, you want to first define what the problem is. Remember, perception is everything. How does the client see the problem? Is it a situational crisis, or what is this? You want to define what it is. Two, you want to make sure, and for the sake of this conversation, I want to use the woman, but you want to make sure the woman is safe, emotionally safe, physically safe, making sure that, she's not in harm's way. And number three, you want to give her that support, emotional support, as well as nurturing support. You want to make sure that she feels supported. She doesn't feel like she's to blame. Number four, you want to help her look at alternatives, even to the sense of the way that she's thinking. She might be thinking this is her fault. She might be thinking she caused this. She might be, having a lot of negative self-talk, and you want to help her with other alternatives. Help her to, see through your supporting of her, that this is not her fault and that she is not to blame, and that there are other ways of looking at this. And then number five, you want to help identify the plan that she formulates. So she's going to come up with the plan. You can encourage her and give her suggestions, but she has to be in charge of the plan. This is a very independent model. So you want her to be in charge of the plan. You're just kind of helping her formulate it. And then number six, you want to make sure that she's willing to commit to the plan by her telling you in her own words the summary of the plan's objectives. Okay, so define, safety, support, alternatives, plan, and commitment. That's the crisis intervention six-step model. Like I said, it's designed for women who are in crisis, but again, this can be used universally. You just have to identify how you're using it and the rationale for using it. Okay. Okay, the last, I'm going to talk about two more. The last one I'm going to talk about, one of the last ones is the cognitive model. The cognitive model is rooted in erroneous or faulty thinking, meaning they are thinking of the problem in a way that's harmful to them. So you want to become aware of their perception of the problem, and you want to literally address irrational thought patterns. So with the cognitive model, their perception could be that God did this to them, or God is punishing them, that they deserve this because they weren't morally good or right. And so you want to help them look at how they're thinking of this, and you want to help them change the way the thought process is going. And so that's the cognitive model. That's very familiar with behavioral cognitive therapy, when you want to help a client change the thought process. And then the last one we're going to talk about is contextual ecological model. And so this model, I kind of briefly mentioned this at the beginning of this lecture. This one is layered and contextual elements, right? And so you want to become aware of time and become aware of layers. So with this contextual ecological model, a client may, be looking at things in time wise, meaning, um, someone always dies around Christmas. Someone always leaves them around Christmas. They always end relationships around Christmas. And they might look at time as a very specific and negative thing in their life. So you really, really want to look at the layers of the elements. Um, from breaking up relationships to death to um, systemic trauma. And so you want to make sure you understand the perception of the client and the time of the client. A lot of negative things may happen around the client's birthday. And so they dread their birthday because they dread that something again is going to happen that's going to negatively impact their life. All right. So those are just a few of the models that I wanted us to touch on. However, I need you to be aware that when you're looking at intervention model, crisis intervention models, the textbook is not exhaustive. Textbook has some really, really great ones. It's not exhaustive. So as you start working with clients in trauma, make sure to do some extra research. There's a lot of things out there and things are coming up every day. And, you know, one of you all listening to this lecture, you might be the one that's going to create a new model. And if so, I look forward to reading that and hearing about that. But for the sake of the class, we're only going to look at models that are already out there. But however, I do encourage you to do some research and find gaps in literature that you think you can add to. You're coming into this field because you have found a need, you found a gap. Um, and you might be here just for this purpose. All right. So I hope chapter one was kind of beneficial. Make sure you continue to read the entire chapter and just be mindful. Take notes of anything that's interesting. If you find a model that kind of sticks out to you, do some extra research, take time, study it, look over it, and see how it can work with some of the clients that you might be working with. All right. Well, I will see you all again soon, and I hope you tune in for chapter two. Have a great day. Bye. Blessings.